Like almost every patient I have who has histamine intolerance describes like an intense sense of fatigue a lot of the time. You think of histamine and you think of allergies, right? And this is not a true allergy to something. So it's more of a threshold issue. People who have functional digestive disorders like IBS likely don't make as much DAO, and that is linked to mucosal changes in the gut lining. So the kind of people who have it are deficient in the enzyme that breaks down histamine.
Hey Marley, welcome to the show today. I'm super excited to chat all things histamine intolerance, which I think more and more is becoming a popular topic, especially on social media. So I'm glad to have you on today so we can really sift myth from fact and learn more about this increasingly common but not so well understood condition.
Yeah, I'm excited to be here. This is a fascinating topic, and I've been finding I'm talking about it more and more in practice, so it couldn't come at a better time.
Awesome. Yeah, so just to get started, for the listeners that don't know you yet, can you tell us a bit more about who you are and who you help?
Absolutely. So my name is Marlee Hamilton. I am a registered dietitian and the team lead at Ignite Nutrition. So we are one of Canada's sort of top digestive health clinics when it comes to nutrition. And that means we specialize in a lot of digestive disorders, complex digestive disorders. So, functional things like SIBO or IBS, as well as more structural issues like celiac disease, IBD, the list goes on and on. But in the last few years in particular, I've found that our practice is really zoning in a lot more on these kind of food chemical sensitivities. So that includes histamine and lots of other kind of unusual intolerances as well.
Yeah, that's interesting. And what got you into, just when you decided to sort of narrow down on a stream of dietetics and nutrition, what really got you into GI health and all its complexities?
Yeah, I get this question a lot, and I always say that I think I kind of fell into digestive health when I started working for Ignite Nutrition. I feel really lucky that I personally haven't struggled too much throughout my lifetime with digestive health issues, but lots of people I love have, and I definitely saw the value there. And like I said, I kind of accidentally became passionate about poop, I guess is the best way to put it. And then again, piggybacking off of that, it's sort of turned into all these other kind of funky passions, like food chemical sensitivities and learning about things that maybe I never even thought existed before, right?
Yeah, awesome. So it wasn't something that you necessarily struggled with, but you just started working in it and found it really fascinating. And
I kind of knew I wanted to do more like private practice dietetics. And, with private practice, you definitely see a lot of these little kind of niches, right? And Ignites was digestive health. So I thought, that's cool. I would like to learn more. And, now I've carved out this really unique niche for myself as a digestive health dietitian as a result.
Yeah, awesome. Plus you do the clinical work with patients, but then also professional development with other dietitians, as I've done.
Yeah.
The dietetic supervision, which was really helpful. And then I know you and Andrea have the Gut Ed, which has a lot of awesome resources and courses too. So dietitians appreciate your expertise.
Oh, thank you. That's so sweet. Yeah, we really try to, take what we do as digestive health specialists and, educate other dietitians as much as possible, because we see some kind of funky different stuff. So there's definitely opportunity to share what we're learning with other people. Definitely.
Yeah, it helps. I feel like even when there's maybe inconsistencies in the evidence or sort of a lack of evidence in a condition, but we're experiencing it with patients, it's really helpful to hear what other dietitians are maybe doing in practice that isn't quite in the guidelines just yet, or maybe not as, I guess, widely accepted, but is working, obviously without risk. But it's good to hear from other dietitians seasoned in those conditions and how to maybe help patients with things that we haven't thought about yet. So yeah, it's definitely been really valuable. So all that to say with histamine intolerance, I do feel, just going on this topic today, I feel like it is something I'm seeing more, like just clients with sort of random skin issues, hives, itchiness, even eczema, seasonal allergies. And then they're also experiencing GI disorders, typically either like IBS or IBD. So can you explain a bit more about what histamine intolerance actually is?
Yeah, absolutely. And I think because there's such an overlap with digestive health, like a lot of folks are presenting with those both intestinal and extra-intestinal symptoms, we're getting a lot more of these people presenting in practice for sure. So for starters, I think probably a really good place to start is what histamine intolerance isn't. So essentially, you think of histamine and you think of allergies, right? And this is not a true allergy to something. So it's more of a sort of threshold issue. We all have histamine within us, and typically we can regulate that histamine pretty well. So if it's, rising, we can bring it back down. And the difference is that with histamine intolerance, it means that we have more histamine on board and we're having a harder time kind of bringing it comfortably back down or breaking it down. So the bucket, if you will, is kind of like overflowing, and that's where symptoms happen, right? If we rewind like even further, I think it's important to also talk about like what is histamine, right? It's a chemical in the body, and we might think of chemicals as a man-made thing, but in this context, we're thinking of chemicals as something that our body is actually making, and it's making it for a reason. And that reason is to help with things like digestion, immune function, nervous system regulation, but we need it. So it's a good thing. But the histamine in our body comes from a few different places, and we create it mainly in our mast cells and a different type of cells called basophils. So interestingly, many of those cells are in our digestive tract, which of course is very interesting for us as digestive health dietitians. But they're also in places like skin and the nervous system and the respiratory system. So like you said, we tend to see symptoms in all of those places when people have histamine intolerance, right?
Would you say in terms of common symptoms that there may be a histamine intolerance, or like, as you mentioned, that someone's not able to clear it effectively and it's building up in their bucket? Is it traditionally sort of those like inflammatory type symptoms that you would get almost similar to an allergy, like itchiness, hives?
Yeah, so if we think about those, if we think about those systems of the body, like we have our skin, for instance. So we will frequently see symptoms like hives or like a flushing or redness or itchiness. So that can be part of histamine intolerance. Another place where we have those mast cells is our respiratory system. So we will often see congestion or runny nose or watery eyes, sneezing, shortness of breath. What's the other systems we're thinking of? The gut, right? Of course, we can't forget the gut. So, we might see bloating or diarrhea, cramping. I would say one that I see a lot in practice is sort of upper GI presentations. So a lot of like reflux or sort of gastritis type symptoms as well. And neurologically, we can see some stuff for histamine intolerance symptoms too. So that's more of the like brain fog, fatigue, headaches. I would say fatigue in particular, like almost every patient I have who has histamine intolerance describes sort of like an intense sense of fatigue a lot of the time. Mm-hmm. Would you agree with that?
Yeah, I would say as well. I think the brain fog is a common one, just feeling like cloudy thinking and they're not able to think clearly. What would you say, like water retention or feeling puffy? Like sometimes people feel
Yeah.
like they just feel really heavy and maybe they're, feeling like they're doing things in terms of supporting weight management or they're exercising, but they just feel like they just have a,
Yeah,
sort of an
kind of
extra
like,
layer on them. Yeah.
I mean, I think the word inflamed probably gets tossed around too much, but that's what people describe it as, like just feeling so inflamed so much of the time, right? Like they just can't, like you said, it's puffiness. It's like, I just feel off. I just feel weird, right?
Mm-hmm.
But I think the issue with going through this really long list of symptoms is that you start to recognize like, oh, this could also be, 20 other conditions, right? So it's a bit of a dangerous game because you don't want to over-diagnose. Well, not that as dietitians we're really diagnosing per se, but you don't want to just assume everyone has this because it can line up with many, many other things too.
Yeah, absolutely. I guess narrowing it down to maybe IBS connection, like we are learning more that there is a link between an increased density of mast cells in the intestinal tract of those with IBS.
Yes.
And with that, could mean that there's higher levels of histamine or maybe more difficulty like clearing histamine is just building up in the body. I am seeing definitely I see it in practice, like an overlap. I wouldn't say everyone with IBS has like histamine intolerance, but sometimes they do go hand in hand. So can you tell us maybe a bit more about just if we've learned more about this connection, even just what the research says in recent years between IBS and potentially histamine intolerance?
Yeah. Now you kind of spoke to it there about like, more histamine in the gut of folks who have IBS. That seems to be the way the research is looking. And I think this is a really good segue into talking about the underlying mechanism of histamine intolerance. So with histamine intolerance, the kind of core theory is that people who have it are deficient in the enzyme that breaks down histamine. It's called diamine oxidase, or DAO for short. Some people say DAO, same thing. But so the idea is like histamine is climbing and we want to be able to bring it back down with this DAO enzyme, but it's not there or it's not abundantly there, right? And I would say the theories right now are kind of looking at the fact that people who have functional digestive disorders like IBS likely don't make as much DAO. And that is linked to, like mucosal changes in the gut lining, because a lot of our DAO is produced in that gut lining. And if it's, damaged or not functioning well, then that might affect our DAO levels.
Interesting. And is it, would you say it's a combination of like a deficiency in DAO enzyme and an increased like histamine production due to there being more presence of mast cells? Or is it,
I think it's probably
sometimes one versus the other, or we're not sure?
Probably hard to say. Like I think we're going to get into it a bit later in terms of, mast cell activation versus histamine intolerance. There's also something called mastocytosis where people essentially like have more mast cells. So there's obviously more of those chemicals just there, right? So there's probably multiple factors for certain people. There might be some folks where it's just, the DAO deficiency, and for others where it might be a bit of a combined issue ultimately.
Interesting. Okay. But more to be learned.
More to be learned. Yeah, that's the takeaway. More to be learned. Yeah. We like to say that, don't we?
Yeah, exactly. In terms of just the connection between the lack of the DAO enzyme and you mentioned like there being maybe a less healthy or less strong intestinal layer. In your understanding, with that being more common in IBS, like what would you say are maybe some sort of digging further into like, I don't love the term root causes, but maybe underlying causes to why the deficiency exists? Would you say there's anything that's maybe more commonly accepted as being contributors to a weakened gut lining?
Yeah, I mean, at this point, again, lots of speculation, but what's out there right now seems to talk a lot about things like, celiac disease, where we know there's like a structural change to the gut lining, or, to the gut as a whole. And I would say the same about like Crohn's or colitis, where we can see some of that structural change. And then the other interesting one that is, I think, a pretty hot conversation when it comes to histamine intolerance is SIBO, small intestinal bacterial overgrowth, as well. I hope that answers your question.
Yeah, I guess digging into that more, like it has to do with the balance of microbes in the gut, like in the context, I guess even, in celiac and IBD, we do see that there's tends to be like somewhat of a dysbiotic state.
Exactly.
So lack of sort of those good microbes, even like bifidobacterium, I think is one example that helps to like maintain that mucus layer, sort of the protective lining in the gut. If we have sort of a loss of those good bacteria and sort of in simple terms, like the pathogenic or the bad take over, that can sort of cause that weakening. And then are you saying that may contribute to sort of a loss of or a decrease in the DAO enzyme sort of things? I guess other things would get thrown off track as well, but that being one of them, the examples.
Yeah, I think, well, what we do know about dysbiosis, I mean, the term leaky gut gets thrown around a lot as well, but when we have less sort of healthy fuel for our good gut bacteria, they will start to kind of munch into that mucus lining. And I mean, it's hard to know what is a, quote unquote, perfect gut microbiome in terms of, how much of this bacteria do we need or that bacteria do we need? But what we do know is we want to, keep the variety and the abundance strong. So I think one area that we should probably be looking at for prevention of things like histamine intolerance is, making sure we are eating lots of prebiotics and things like that for prevention.
Yeah, especially in the case of IBS, like we've seen that people with IBS tend to have a much less resilient, less diverse gut microbiome. And then, as you know, when you get a GI condition like IBS, you often develop a lot of fear around foods and then begin to restrict a lot of foods, even doing like low FODMAP for too long and not diverse, then that can further weaken the gut diversity, and can see how maybe that could contribute to histamine intolerance long-term if someone's eating a really restrictive diet and not feeding those good bacteria the fuel that they need, and in times, sometimes make things worse as well.
Yeah, absolutely. Absolutely.
So in terms of histamine intolerance, and then you mentioned mast cell activation syndrome, which are not the same. Can you explain I think they do, people use them interchangeably, but can you explain the difference between these two conditions?
Yeah, absolutely. I think thinking about that sort of underlying cause is really helpful for establishing that difference between the two. So, as a quick reminder, histamine intolerance is stemming from that deficiency in DAO. I shouldn't even say a deficiency necessarily. It might be just poor function of DAO in some cases. But basically, they're seeing histamine levels climb as they do. That is pretty normal for most people, but they're struggling to bring it back down without that enzyme. And alternatively, mast cell activation syndrome, or MCAS for short, is a condition where our mast cells in the body release chemical mediators like histamine more spontaneously or sort of like abnormally than they should. So we all have those mast cells, but in a, quote unquote, normal system, they are essentially unactivated most of the time. So unless we're like, getting stung by a bee or something kind of, traumatic where we need those mediators, we're not releasing histamine all the time like that. But with MCAS, we are, right? So they're sort of activating excessively. And now we have this extra histamine floating around because of that.
Interesting. Is it considered an autoimmune condition? Or
I don't believe so. No.
okay, interesting. And again, digging deeper into that, like, do we know why that might occur? That the mast cells just kind of go off normal course?
I mean, although I don't think it's technically, lumped into an autoimmune disorder, I do see that it tends to be pretty common with other disorders like that. So maybe it's just too early to kind of categorize it, but I would say that. Sorry, can you repeat the question?
Yeah, do we know, like, in terms of the mast cells not like operating as they normally would, so just constantly releasing histamine, do we have any understanding of why they might start doing that, or what may contribute to that, like, that condition developing in the first place?
Right. Yeah. So I would say, like, it's pretty commonplace in people who also have other sensitivities. I mean, that's not a sure thing, but it seems like, it's a lot of folks who would have other, like seasonal allergies and things like that. But again, I don't think it's fully elucidated at this point. It feels like that's the answer to a lot of this, but ultimately, no, we don't know why certain people develop it. It does seem to be a bit of a viral connection. So for example, I'm sure you can agree with this, Lee, but like since COVID, we've seen kind of this uptick in mast cell activation or histamine intolerance cases. And, not that that's a sole reason, but it does appear that a lot of folks will, after having a bad viral infection or even like parasitic or other types of infections, will often start to develop these sort of inappropriate responses like mast cell activation syndrome.
Yeah. So yeah, it could be multiple different things. I would say, I guess a lot of conditions, maybe they're not considered an autoimmune condition, but I feel like they're almost always is like an immune system link. Mm-hmm. Like a lot of things are just your immune system acting abnormally in a response to try to take care of you. But
it reminds me of sort of like, with something like celiac disease, for instance, we know like the body is sort of inappropriately thinking that this thing is a foreign thing, right? And sure, these are not identical at all, but I think we can think of it in a very similar way where it's like, okay, we know we're not actually getting stung by that bee or eating a peanut that we shouldn't eat if we're allergic to peanuts or whatever, but the body is sort of acting like something very traumatic like that is happening, right? Mm-hmm. Although with mast cell activation and histamine intolerance, it's not as immediate as an allergy would be.
Right.
Typically.
It can be a more delayed reaction. Like, I guess you mentioned it's about a histamine buildup in the body, so it can kind of slowly creep up on someone, and it may sort of build up depending on how full their bucket is, as you said.
Exactly. Mm-hmm.
This might be a little bit of a controversial question, but I know that there's been a lot of talk around like just the COVID vaccine and contribution to like different immune disorders or people seeing a spike in their conditions. Is there any link between like the vaccine itself, not COVID, and mast cell activation syndrome, or you're not aware? It's okay.
I'm not aware. No, I'm not. I haven't seen any literature on it either way. Not to say that there isn't any. I just haven't poked around. So I'm not sure. Mm-hmm.
Okay. Just curious. I wasn't sure if you know that one, but and then with histamine intolerance, would it, if someone had it but it went unmanaged, could it turn into mast cell activation syndrome, or are they not? Like,
I don't think we have the confidence to say that yet, just because the underlying mechanisms don't appear to be linked. Like if it's a DAO issue, it seems like that's its own thing, and then the activation of the mast cells is very much its own thing too. So I don't tend to see that immediate link.
Okay. So in terms of histamine intolerance specifically, I know yeah, as I mentioned, I see it, not too commonly, but overlap definitely between IBS and SIBO patients. Would you say that it often like gets sort of misdiagnosed or underdiagnosed in
Yeah.
practice?
Yes. I
Yes.
would say so. Now, this is an interesting topic because I think it's like very much it reminds me of IBS. You know, people treat it sort of like a umbrella statement, like, oh, you know, it's you don't have this allergy. You've gone to the dermatologist, and their skin was fine, and you know, all of these things have been ruled out often, and then people just go, well, it must be histamine intolerance, right? And it, like I said, it reminds me of IBS, which is also a very real condition, but it's kind of like you don't have all those other things. It's IBS. And I think for that reason, it kind of gets maybe missed, right? So not only that, but it's just not well understood or well defined. And therefore, I think a lot of our doctors and our specialists just, you know, they're not always looking for it. They're looking for the other kind of big stuff, right? And that unfortunately discredits histamine intolerance as a real thing, but it is a real thing. Mm-hmm.
Yeah. And from my awareness, I guess the best way to assess whether someone does have it is typically like a trial of a low histamine diet. I think roughly is it 2 to 4 weeks? Yeah,
We
around there, and
usually
see if symptoms improve.
Yeah, in our practice, we typically do 4. I just find, I mean, obviously it's very fluid, but we find that, you know, there's a bit of an adjustment period. So sometimes 2 weeks is not quite enough because there's a little bit of like making mistakes at first, right? Very normal. But yeah, at this point, we don't actually have like a true kind of biomarker to diagnose histamine intolerance. So really we're using kind of call and response, like how do we respond to the treatment, which would be, there's a few things, but our primary kind of gold standard treatment is that low histamine diet. So I will say there were some proposed tests. I was reading around some of the research, and one of them is DAO concentrations in our blood. So
Interesting.
well, that is fascinating. It is not yet a successful biomarker to diagnose someone. Although it's pretty cool because we can use it as more of like a clinical or like a predictor of clinical response to treatment. So there was one study in particular, I think it was a few years ago now, where they were able to find that like symptom severity correlated to DAO concentrations. So specifically, folks who had lower DAO, so lower levels of that enzyme, had more severe symptoms, which makes sense for what we know, right?
Yeah.
But the authors were very exclusive in saying this is not enough to like use this as a diagnostic tool yet.
Yeah, that's fair. Yeah.
I wish.
And I guess, yeah. Where would you even, do you know where you would access that test? Let's say here in Canada.
Yeah, I mean, that's the other barrier, right? Like, it's so cool to see these research studies, but, you know, it is a blood test. So it's, you know, ideally not all that invasive because blood work is accessible, but I don't think many of our labs are testing for something like that.
Yeah, that's fair. In your experience, when someone does have like confirmed histamine intolerance, do you find that it's usually because you've suggested it and you've explored it with the patient, or is it like another practitioner has sort of come to that conclusion?
I would say a little bit of both.
Yeah.
Definitely a bit of both. You know, I think, you know, often patients are like explaining all their symptoms and I'm like, oh, this is classic histamine intolerance. It sounds so much like that. And then we can start to get them the right, you know, treatment tools and ruling out other things that might need to be ruled out before we can sort of confirm. But the other thing that happens a lot with histamine intolerance is the internet, right?
Yeah.
People find it on their own. And we know how that goes. So I often find like a lot of folks will, self-diagnose and misdiagnose because they start reading, a forum or a blog, and it's like, oh my gosh, I have all these things. This is it. And when we actually meet the person, because they come in with histamine intolerance on their chart, it's fairly obvious, not always, but sometimes, where it's like, okay, something else is happening. This is probably not histamine intolerance, right? So it works both ways for sure.
Yeah, interesting. Interesting. So I guess for someone listening who's thinking, okay, this could be me, I may have histamine intolerance, and they start Googling what foods to eat, or perhaps ask, as some people are doing these days, ask ChatGPT to help them with the menu plan. I know what I would say, but what would you just say to those people thinking that maybe they can try to find the right foods off the internet?
Yeah, it's tough. So as we've sort of established, the sort of gold standard for figuring out whether you have it is to see how you respond to that low histamine diet. So you're not in the wrong direction entirely at all, if that's you. But the lists vary so much online. I'm sure you've noticed this as well. There's so many discrepancies between what you have to avoid depending on where you're looking, right? So really, at the core of it, a low histamine diet is reducing foods rich in histamine, and those tend to be, aged or cured foods, fermented foods, generally foods where there's been sort of like a bacterial process that took place. Those foods are going to have higher histamine because those bacteria create histamine as a byproduct. Leftovers can also be a big one because the older a food gets, the more it's been developing bacteria and the more histamine can develop, right? So that's kind of the basics, but then we also have what's called histamine liberators, just to make things more complicated. And these foods are not inherently high in histamine generally. They are more, they're kind of like the initiator, once we consume them, they will sort of activate that histamine release in the body. And it depends on the person, but I'll often start with just like the heavy hitters first. Like, let's cut out those fermented and aged foods. And if we're still not seeing response, maybe we'll look at some of those liberators next. And that's what I love about this diet in a weird way, is like there's so many opportunities for customization depending on the person. But that's why I highly, highly, highly recommend working with, a dietitian who understands histamine, because the lists you're going to find online vary so much, right? And there's a couple reasons they vary. I mean, the biggest is that this is still a very young condition. We're still learning a lot about this. But the other thing is that there's really poorly defined cutoffs. One resource might say, this is too much histamine, and another might say something entirely different. And that's where we just simply need more research. And then the other thing is histamine content can kind of vary, right? So we might have two foods in the same category. Let's say it's a cheese, right? And depending on, things like manufacturing, how long it was aged, you're going to get very different levels of histamine. Well, maybe not very different in every case, but different, right?
Yeah, so there's a lot of, I guess inconsistencies and a lot we don't know about it. It's not as, not nearly as, well, I wouldn't say that low FODMAP is necessarily clear cut, but there's a lot more resources and support for it. Like we have the Monash food guide and the FODMAP friendly food guide and the testing laboratories and lots of great resources online and food scanners and all that, but we just don't have that for a low histamine diet yet, or sort of a widely accepted guidelines, which can make it tricky for patients. But as you mentioned, a good thing, really, I would say a key takeaway from this is that there's individual tolerance levels. So, you probably don't need to follow a strict histamine-free diet. It's just about finding an amount that will
Yeah.
be okay for you and not trigger your symptoms, but should be as varied as possible, because we don't want to run into, too much restriction where we're then impacting the gut microbiome, or you're developing, nutrient deficiencies or fear around food and anxiety, because all those things will then also make gut symptoms worse. So
Yeah.
we have to be careful with it as well.
I find in a lot of my clients, you can almost see the patterns unfolding when you look at a food journal, right? It's like, oh, every time I eat yogurt, I feel this way, which is a fermented food, right? And sometimes even just making those like basic, entry level swaps is all it really takes to get to a level of comfort for these people, right?
Yeah, totally. Yeah, that's a good point.
Mm-hmm.
I would say if there's two topics where I get like the most criticism, or let's say online hate, one is the stool microbiome test, which we won't get into, but the other one is fermented foods. I find I always get like, I have a blog about fermented foods, or if I mention it somewhere, I always get comments of like, fermented foods are not good for people with gut issues, or they're not actually good for gut health because they're high in histamine. And anyway, so I think there's a lot of maybe misunderstanding about histamine. And for people who are okay with histamine and that's not an issue for them, I would say that, I think you would agree.
Yeah,
that
eat your living foods. Like that's for someone who's not struggling with these issues that we're talking about today. Like I think it's an important thing if you can tolerate it, right?
Yeah, definitely. So with that all in mind, so we're thinking about, maybe a structured elimination diet, and see how you respond with a dietitian, and, find the tolerance or the amount of histamines that you can tolerate. Aside from that, is there any other tools that you use in practice, like any specific supplements or any, let's say, other dietary considerations that you would say just generally can help with improving histamine tolerance?
Yeah. So, I mean, there's a lot of dramatic claims out there, I would say, when it comes to this topic, but many of them are unfounded. Surprise, surprise. What I will say is that because with histamine intolerance, the driver is that DAO deficiency, or like poor coordination of DAO enzyme, a lot of folks will benefit from supplementing with a DAO enzyme supplement. A lot of it was very speculative for a really long time, but there actually is some pretty good research emerging on it. And the trends seem good, which is awesome. So folks who have histamine intolerance do seem to respond positively to DAO enzyme supplements. And I would say I've seen that in practice as well. Mm-hmm.
Interesting. Okay. So, do you have any particular, it's okay if you don't, but any certain products or anything to look for, or?
Yeah. So it's kind of the Wild West, like many supplements, but there are sort of animal-derived DAO preparations, and then there are plant-derived. So the animal-derived preparations come from pig kidney, fun fact, and the plant ones come from peas, like green peas, essentially, or a specific type of pea. And most of the research that says, DAO supplements help with histamine intolerance are specifically done on the animal-sourced DAO supplements. So we don't have as much solid evidence to say that those plant-based ones are going to respond the same, but at this point it looks good. And I would, again, in practice, I find it's the same. Like people who use it, not everyone seems to find benefit, but like the people who like it. You know what I mean? They're like, oh, okay, I definitely notice a difference here. But interestingly, they're formulated different. There's not a lot of standardization, unfortunately, but there are some that have I guess you would call them cofactors. So vitamin C usually would be like mixed with the DAO. And the other one is called catalase. So products that have the catalase and the vitamin C have been shown to help DAO work better, essentially. And the reason is because DAO, when it breaks down the histamine, when it does its job, it does produce a little bit of hydrogen peroxide as a byproduct, which can also kind of be irritating for our body. So those helpers, if you will, the catalase and the vitamin C, are going to like kind of break down that hydrogen peroxide into essentially just like water and oxygen, right? So it kind of like collects the problem at the end and gets rid of it. If that makes sense.
Interesting. And yeah, from a nutrition perspective, do you think, as if we're thinking about, just supporting the intestinal barrier, any like sort of foundational nutrition considerations you might have for someone as well, like just to work on kind of that underlying cause or contributor?
Yeah, I mean, the biggest thing that I would focus on there is trying to enhance variety wherever we can, especially plant-based variety. Those gut bacteria, they love fiber, specifically prebiotic fibers. So, not that we have to focus on like the most prebiotic rich foods all the time, but just like trying to have different types of plants as much as we possibly can, so that those bacteria are not looking for fuel in that mucus lining in the gut. I kind of mentioned that earlier, but I think people often get so focused on what supplement can I take, or, how do I hyper optimize my digestive health? And it's like so much simpler than that, right? Well, I shouldn't say it's simple. Adding variety can be really challenging for people, but, like before we even think about these like really deep-seated tweaks, we have to look at like adequacy and variety. Are we getting enough, right? So that's usually what I focus on.
Totally, yeah. I would say in practice, probably with a lot of IBS and SIBO patients, I think common, I wouldn't say we always confirm that they're deficiencies, but like insufficiency in their dietary intake. Zinc, vitamin C, selenium, protein sometimes too, which all play a role in like, cellular health and repair, and also keeping that lining healthy too. So even just making sure you're getting enough from diet, or sometimes, being selective with supplements to correct a deficiency if someone has a difficulty getting it from food, and keeping that in mind as well. But yeah, there's a lot of, I think, kind of crazy supplements out there that people are prescribed, and it's kind of, missing the mark in terms of really just laying that good foundation first. I'd even say with enzymes too, I think they're kind of like probiotics in a sense, where, we think, we can just take a digestive enzyme and it'll help with our gut health. But to this point as well, like it kind of depends on what you're dealing with. Like, do you actually have a histamine intolerance? And then a DAO enzyme may help you better than just like a general digestive enzyme or something else. So always being really selective about what supplement you're choosing to address the actual problem that you have, and making sure that there's some science to support that.
Absolutely. Yeah. And like we do have our own like endogenous histamine, right? It's not all coming from external sources. The interesting thing about DAO, the supplement, is that it only functions in the gut, essentially, right? So like this is actually a very, important sort of timing piece of things, which is that we want to take our DAO with a meal, right? And the reason being that we kind of want it to like ride along with the histamine that we're eating. And then in the gut, when they arrive there together, they're going to, kind of help each other out, right? The DAO should be, kind of tackling the histamine that you've consumed. So it's a great thing to recommend if if someone's going out to dinner, or maybe they're kind of eating off the plan because of the holidays or whatever. And that gives them more flexibility, which I'm all about, right? Like if we can, take away some of those eliminations and restrictions, amazing. DAO can be expensive on the market. So I find a lot of my patients are not using it constantly. Some of them do, but it's usually more like special occasions. I want to eat a little more liberally here. And it's just a way to stretch your dollar a little bit more, because at home they might feel like they can control the narrative a little bit more with their histamine intake.
Yeah, that makes sense for sure. And one other thing I did want to ask you about is whether there's any connection with iodine. So I think it is sort of re-emerging as potentially like a deficiency in North America. I think just because we used to see it more, and then it was sort of corrected by introducing iodized salt, which now a lot of people don't consume anymore because we love to use sea salt, and we've heard that it's healthier for us. And then just a lot of people, I guess, depending on location too, are not eating as much seafood, or a lot more people are going plant-based. Even thoughts that maybe farmed seafood has lower levels of iodine. So potentially, less of some of us are not getting enough. And I did see somewhere, and I wanted to ask you if you've digged into it more, but is there any connection between like low iodine and histamine intolerance as far as you're aware?
Yeah. First of all, the deficiency, that's so interesting, right? That we're starting to see this pattern reemerging because of, health trends with salt. I have seen some claims about iodine with histamine, kind of the wording of like, oh, it decreases histamine in the body is what I've sort of seen floating around. But I have not seen any peer-reviewed studies that would confirm that. However, I do think that there could be like an indirect link here, right? So this might be a bit of a stretch, but, with iodine deficiency, which again seems to be cropping up a little bit more now, we sometimes will see like thyroid changes as a result, and that can slow down motility and, change dynamics of digestion. So, unfortunately, slow motility can be a driver of something like SIBO, which might precipitate histamine intolerance. So it's kind of this like chain reaction potentially. But I think to just come out and say low iodine causes histamine intolerance or affects DAO activity, there's really not a lot to confirm that direct of a link that I can see.
Yeah, that makes sense. That was sort of my thought as well, that maybe it's connected to sort of a slowed thyroid function, which then in turn may impact how the gut is functioning and sort of set you up for those other conditions that are linked. All that to say, if you're not eating a lot of shellfish or you're vegan, just considering if you're getting enough. I love, you can get like dulse flakes or kelp flakes. They're really high in iodine, and even using those like a couple times a week, or sea vegetables. Yeah, they're important. All things like our macronutrients, but also micronutrients, minerals, they all play a role in our gut health too. So
yeah, absolutely. And it really puts it into perspective that like one shift in a trend like sea salt can change so much with the population as a whole, right?
Yeah, totally. Or even emphasis on plant-based diets. And sometimes we forget there's certain minerals that you can get more easily from an animal-based diet that you need to still have consideration for if you're eating more plant-based.
Absolutely.
So, nutrition is so complex.
Yeah, so iodine, I would say, is like, the research is not super strong. But you mentioned zinc earlier, like something like that. There is more evidence to say that zinc supports gut barrier health and sort of immunity as a whole. So I think that one sort of makes more sense to me. And, that being said, like, I don't think everyone needs to be supplementing. I think, if we feel there's a lack of zinc, like let's do the proper testing look at the person's diet. Are they eating zinc rich foods or not? There are a lot of high dose zinc supplements out there, and there's actually such thing as zinc toxicity too. So we don't want to overdo it by just like putting everyone on a supplement either.
Yeah, absolutely. Yeah. And it's sometimes if you take too much of one mineral, it can crowd out other minerals and create a deficiency elsewhere. So yeah, the balance and the ratios are important as
Absolutely.
well. Okay. Well, we went through quite a lot today. It's very interesting conversation. I guess, is there anything else you want to add, or any kind of final thoughts about histamine?
Yeah, I mean, like there's so many things we could be covering here. There's also the role of things like antihistamines, like the medication side of this. And, as dietitians, I wouldn't say that's our bread and butter necessarily, but I in practice definitely see folks who will do well by adding like a Claritin or, something like an over-the-counter antihistamine. Now, what's interesting is it doesn't likely do much for the DAO activity, right? Like it's not going to impact that side of it. But in practice, I find a lot of people, I kind of said this earlier, a lot of folks who have histamine intolerance have other allergies, right? So they might struggle with pollen and hay fever or fragrance or cats or whatever. And they're just like, their bucket is just so full so much of the time. So by taking an antihistamine, for instance, that might allow more space for, dietary histamine, for example. And then on the mast cell side of things, again, we could do a whole other podcast, I'm sure, but like there's mast cell stabilizer medications and supplements. There's something called quercetin, for instance, which is a mast cell stabilizer. And again, like there's so many, different areas you can explore. But I think with the medications, you really do have to know more about what's the underlying driver, right? Because mast cell stabilizers are not always going to work as well for the kind of DAO deficiency group as it will the mast cell activation syndrome group, right?
Yeah.
But
and I guess exploring what people feel good with as well. Like if the medications help them and they don't get any side effects, then that's cool. But maybe making those dietary changes and just reducing the input of histamine, they feel better on that. So kind of exploring that, like you said, with a team who's knowledgeable, both doctor and dietitian.
yeah, absolutely. And I think, while the diet is a huge part of care, like if we think there's something else driving this intolerance to histamine, for example, maybe it is SIBO, and we can tell that they have a lot of those, coexisting symptoms with SIBO, like severe bloating or changes to their bowel habits. It might not hurt to get that ruled out, and because that's going to take us down a very different treatment path typically, right? If we feel that SIBO might be there and that's maybe driving that histamine intolerance, as it can because of those, gut lining changes we spoke about, that is going to mean they might need antibiotics to treat that. And often when we figure that out, they're not actually sensitive to those high histamine foods anymore, or not nearly as sensitive. So sometimes we have to be thinking a little more upstream instead of downstream. I had my analogy all mixed up, but there's so much you could dive into here for sure.
Yeah, definitely. And I think it's good to always explore the underlying cause. And even if you can get deeper than that, the underlying cause of that cause, and trying to essentially treat or address things at the source, can be helpful as well. And I would say, like you mentioned, not all doctors are maybe up and aware of it. So that's why with these things that are GI related and they're related to the food that you eat, I think exploring working with a dietitian as well can be helpful. And and it can be tricky. I know we both are in Canada. You're in Nova Scotia, right?
Yeah, that's where I live. Yeah.
in Ontario, and it's difficult sometimes to get doctors to take you seriously or sometimes order the right testing. But just working with, I think an interdisciplinary team who understands your condition and is able to help you explore like what options are available to you and really get to the underlying issues is always important.
Yeah,
as well.
absolutely.
So,
yeah, we can be great advocates as dietitians. That's what I always say.
Yeah. So with that, how can listeners find you, get in touch, learn more if they would like to?
Yeah, so I'm on Instagram. My handle is at Dietitian Marley. If you want to check me out over there, I'm trying to get more active on Instagram. And for direct work, if you want to work with me one-on-one, I work for Ignite Nutrition, like I said. And our website is ignitenutrition.ca. We can see Canadian clients. Depending on where you live, I'm registered in several provinces at this point. And if you're a dietitian, like you mentioned before, and you want to kind of enhance your, complex digestive health knowledge, myself and my colleague, Andrea Hardy, we run Gut Ed, which is an online school for dietitians. Everything gut health is there. We're doing an awesome journal club every month. That's my favorite thing so far. We get to review, relevant research on digestive health nutrition and chat about it with our colleagues, which is so fun. And if you want to go over there, it's gut-ed.com.
Awesome. I will include those links in the show notes. And yes, I'm part of the journal club as well, and I've been enjoying it. It's nice to talk about journals and not just read them on your own, but be able to discuss it. So
yeah, I really like the kind of like, how do we apply this to practice piece of it? So I highly recommend people check it out.
Yeah. Awesome. Well, thank you so much, Marley. This has been a very insightful conversation. And if anyone has any questions, comments, you can leave them directly on the episode wherever you're tuning in from, and we will get back to you if we see those come in as well. So thank you so much.
Thank you for having me.